Hi there, and welcome to our last webinar in this series from the Parkinson's Foundation Expert Briefing Series. This is our 9th series so far in our existence. The title of today's talk is going to be Living Alone, Home Safety and Management in PD. I'm Dr. James Beck, your host for today's discussion. I'll tell you a little bit about our webinars. They are not created in isolation. These are ones that have been really developed with the feedback of the community, and I'm really pleased that our regional Parkinson's organizations, part of our Alliance of Independent Regional Parkinson's Organizations called AIRPO, are working with us together to help generate the topics for these and our webinars, which are coming up for our next series in 2018-2019. So I'll tell you a little bit about that at the end of our discussion today. I'd also like to thank our sponsors. Our sponsors are critical for helping to support this series, and we're very indebted to their generous support. AbbVie, Synovian, and Lundbeck, thank you for your support. If you want the slides that are going to be presented, just take a look at your screen. There's a button that's in blue. It says Download Slides. So just click on that button, and you'll be able to download a PDF file that you can look at any time during this webinar or even after. If you're a health professional, you have an opportunity to earn one free CEU through the American Society on Aging. So if you registered as a health professional during the registration process and indicated that you'd like a CEU, you'll receive an email by the end of today on how to collect this credit. But remember, you only have about 30 days until July 5th to collect your free CEU, so act fast on that. It's my pleasure to welcome our guest speaker today. Dr. Erin Foster is an assistant professor of occupational therapy and neurology and psychiatry at Washington University School of Medicine in St. Louis. She just received her clinical doctorate in occupational therapy in rehabilitation science and has completed postdoctoral training in clinical neuroscience and cognitive neuropsychology at WashU. Dr. Foster's research focuses on understanding how cognitive dysfunction in Parkinson's disease impacts everyday life and how cognitive rehabilitation approaches for PD and general self-management can be used to improve PD. She has federal and foundation research grants related to this topic and is a licensed occupational therapist and consultant with WashU's program in occupational therapy and clinical practice. Dr. Foster helps guide therapists treating clients with Parkinson's disease and related disorders. Dr. Foster, welcome to our conversation today.
Thank you for the introduction. So this talk is about managing home safety problems, and the title is Living Alone, but really most of the things I'll be discussing today will also be relevant for people who live with others. And I understand that there are care partners in the audience, so that's good. I also want to give the caveat that I understand that there are people from a number of different countries listening in, and I'm from the United States, and many of the examples and some of the details that I'll be talking about might be specific to the United States, but there's still plenty that you can take away if you live in other countries. All right. So first, I'm going to present a framework and a process for thinking about and solving home safety problems. And so the idea is that I'm going to give you some generic tools that you can start using to solve your own problems. So the generic tools are going to be relevant to everyone in the audience, whereas the specific solutions that will result from using these tools are going to be highly individualized. Then we'll apply the framework and the process to the home safety issue of falls in Parkinson's disease as an example. But again, these frameworks and this process can be applied to any home safety issue or functional problem. And so that's what you'll have to work through and figure out in practice after this talk. Then I'm going to cover a few other specific topics related to living alone. Again, many of them will be relevant for people who don't live alone. And, you know, I have a lot of information to cover and not a ton of time. So throughout the talk, I'll be providing some resources that you'll have to explore on your own after this talk. And I also want to remind you that in addition to being able to download the slides, this will be recorded. It'll be available on the Parkinson's Foundation website after about a week if you want to listen again and review. All right, so this figure is a synthesis or adaptation of models that occupational therapists use to understand someone's function in daily life and to guide their treatment. So someone's performance or participation in daily life is determined not only by their personal abilities, but also by the activity that's being done in the context or the environment in which it's being done. Many of you with Parkinson's disease, when you think about your daily function, you probably attribute any functional problems or changes that have occurred to changes in your own personal abilities that have resulted from Parkinson's disease itself. However, activity and environmental factors also play a role in your daily function. So activity factors are characteristics and the demands of the things that you need and want to do, as well as how you do them. And environment factors are basically where you do things. So in terms of physical space, but also social, political, and cultural contexts are relevant. So it's the dynamic interaction of all of these factors that result in your daily function, which for our purposes today is your safety at home. So the nice thing about this model is that it provides multiple modes of entry or different types of solutions for functional problems. So in the case of falls and Parkinson's disease, it's possible to improve person factors or person abilities like balance or gait and reduce the risk for falls. Oops. However, at least with our currently available treatments right now, it's unlikely that these abilities are going to return to normal levels, so the risk for falls is still elevated. But luckily, there are other avenues, changes that you can make to your activities in the environment to further reduce your risk. And so we'll spend some time talking about those today. Okay, so that framework provides some content related to solving daily functional problems, and now I'll walk you through a general process for doing so. Many of you may be familiar with this general problem-solving approach. We'll go over it quickly now and then more concretely as we apply it to falls. But one way to label it is goal, plan, do, review. So that describes the four main steps of this problem-solving process. So starting in the top left with goal, first you need to define and understand the details of the problem and then develop a goal or an end state that you want to be in. So what realistically would it look like if this problem were solved? Then you plan. Once you have a really good idea of what the problem is, you brainstorm potential solutions, and then you pick one or multiple to try. And if it's a complex solution, you might need to list the steps or make a detailed plan for exactly how you're going to implement it, and that'll increase the likelihood of actually doing it. So then you do it. You try it out. And you want to make sure you give it a good effort and a chance because some things might take some practice or some time to sort of settle in before you know what the effects are going to be. And while you try it out, you pay attention to whether and how it's working, so you review it. You may find that it's just not going to work and it needs to be scrapped, in which case you try something else from that list that you generated in the plan phase. Alternatively, it may just need some modifications to work. Once you've found something that seems useful, you can kind of hang around in the do and review phases, making slight tweaks to optimize it so it's the most efficient and effective that it can be. And at this point, you can even consider layering in other solutions that you generated during that plan phase. So it sounds simple enough, right? Many of you probably already use this type of approach intuitively, but I found that being very explicit about it, knowing what the steps are and where you are in the process, really improves its usefulness and I think reduces the likelihood that you might give up trying to solve a problem before you've considered all possible options. So it helps you be thorough. Okay, so now we're going to apply these two models to the most common home safety concern in Parkinson's disease, and that's falls. So falls in people with PD occur at double the rate compared to the general older adult population. The risk for falls increases with disease duration and severity, but they're also common early in the disease. So the problem is relevant for most anyone with Parkinson's disease. And, we all know there are many negative consequences of falls. Aside from the injury and possible pain caused by the fall itself, they can lead to difficulties performing activities and loss of independence. They contribute to caregiver burden and nursing home placement. They can also result in fear of falling, which is a risk factor itself for future falls and restricted activity, and they're associated with reduced quality of life and participation. And there are a number of risk factors that can increase the risk of falls in people with Parkinson's disease. Many of you probably know about the person changes caused by PD or its treatment that can contribute to falls. So these are things like postural instability, gait problems, visual changes. There's also orthostatic hypotension, so that drop in blood pressure when you get up. Even things like anxiety and stress can increase other Parkinson's disease motor symptoms and thus the risk for falls. But again, there are also activity and environment-related factors that can interact with your personal abilities to cause falls. So some activity-related factors that contribute to falls in PD include dual tasking, or trying to do two things at once, specifically something that requires thinking while walking. There are also issues, temporal issues, or issues related to time. So in Parkinson's disease, your function can fluctuate throughout the day, and so your risk for falls will correspondingly increase or decrease throughout the day. Also, when people are experiencing time pressure and start to hurry, that can increase their risk for falling. Sometimes you go through the movements on autopilot or without thinking, which is especially problematic for people with PD who lose some automaticity and thus need to pay more attention to what they're doing. And there are some specific activities that are associated with falls in people with Parkinson's disease, and that includes reaching and bending, turning, and also transferring to and from surfaces. Environment-related factors that contribute to falls in PD include tripping hazards like throw rugs and cords due to shuffling gait, inadequate lighting, and then also if you have problems with freezing, being in crowds, or going through doorways are some environmental factors that might trigger a freeze and a subsequent fall. And so remember, falls result from an interaction of these factors. So it's not only that you have poor balance because of Parkinson's disease that causes falls, but it's because you have poor balance and you were reaching to get something from the top shelf while being in a hurry. All right, so how can we address this problem? Now we're going to move on to goal, plan, do, review, that problem-solving process. So first, as I said, you really need to understand the problem. The previous slide helps us understand falls in general in Parkinson's disease, but the key risk factors or their combination is going to be slightly different for everyone. It's highly individualized. And so the best way to understand your specific problem, if it is falls, is to start a fall diary or a log. And so this fall diary or log is not only for recording that a fall happened, but for really analyzing the falls, really understanding the circumstances under which they happen. You also probably want to do this for near falls because prevention is important. And I would say that it's best to try to complete the log or the diary right away, but I know that's not always possible, so you might need to set aside some time each night or each week to review your falls. So your fall log should serve the purpose of prompting you to answer these questions. And you really want to be specific in your answers. So where was I? What was I doing? An example of being specific would be instead of saying, oh, I was making dinner, you're going to want to say, I was getting the bowl from the top right cabinet while I was making dinner. When did it happen? That could be the time of day. It could be sort of your medication status. It could be before or after certain events. So it happened after the grandkids left. How did I feel? Was I tired? Was I on or off medications? Was I stressed? Or did I feel just fine? Then you're going to take some time and really try to think about why it might have happened. And you might not know for sure, but I encourage you to take a guess, and you may start to notice patterns. And you can use that person, activity, environment framework to help you think of all possible reasons and really be thorough. And then this is really important, and it leads into the next step of the process, but try to come up with answers to the following questions. Is there any way that the fall could have been avoided, or anything you could have done differently or would do differently next time to avoid it? And you're going to want to be as creative as you can for these last questions. And remember that you're the one that has expertise about yourself and your situation, so don't be afraid to answer these questions creatively. And like I said, you might start to notice patterns. At the same time, it may also help to share your fall log with someone else and get their input because they might think of things that you didn't think of. So you'll gather data, you'll start to grasp the problem, and then it's time to come up with possible solutions. And so this is where thinking about the person, activity, environment framework can be very helpful. As prompts to brainstorm solutions, ask yourself these questions. What can I change about myself or the person? What can I change about the activity? So what I'm doing, how I'm doing it, when I'm doing it. What can I change about the environment or where I'm doing it? And then also, this is sort of outside of that framework, but who can I ask for help? So there are lots of different answers to these questions, and the answers are highly personal and individualized. But now I'm going to go through some common and relevant answers for people with Parkinson's disease. I'm not going to spend too much time on person factors because Dr. Faye Horak actually gave a great webinar on the best solution related to person factors earlier this year. So I encourage you to check that out. But basically the solution with the most supportive evidence at the moment is exercise or training to improve your balance, your gait, and your functional mobility. Other possible ways to address some of the person-related risk factors for falls are speaking with your doctor about adjusting your medications to potentially deal with wearing off issues or dyskinesias or orthostatic hypotension. And you probably should even share your fall log with him or her because they might be able to notice patterns that may be associated with your medication regimen. So it might help them tweak your meds. Practicing mindfulness may help to reduce stress or anxiety, which could reduce falls, and also ensure that you aren't hurrying, but instead are attending to the act of walking and how your body feels so you don't act before you're ready. So it can reduce that autopilot mode that I talked about where we move without thinking. And then to the extent possible, you're going to want to practice good sleep hygiene or seek treatment for any sleep disturbances to possibly reduce fatigue and daytime sleepiness. Now on to activities and environment-related changes. And I want to note that these are common and anecdotally or kind of clinically effective solutions, but there isn't much research or evidence on these strategies specifically in PD to date. So that's something that we're working on. But as I said, these are sort of well-known types of solutions that many people have found or say are useful. So in thinking about what you're doing or how you're doing it, activity-related factors. First of all, dual tasking or doing something else while you're walking is a known contributor to falls in PD. So you want to try to avoid that as much as possible. Dr. Horak actually presented some evidence related to training and getting better at dual tasking, but in your day-to-day life, especially if you're alone, it's probably best to avoid it altogether until you've potentially gone through that training and are confident, and other people are confident in your ability to dual task. So you're going to want to wait until you're sitting to talk on the phone. If you want to have a conversation with someone, stand still or find a place to sit. You can also sit down while you're performing other daily activities like dressing or cooking. Along the same lines, you'll want to keep your hands free while you're walking. So use a fanny pack or a bag or your pockets for items that you want to keep close at hand. This will help you avoid dual tasking, but it can also help you keep your weight centered, and it can allow you to swing your arms appropriately, possibly catch yourself if you fall, or at least grab onto things for support. There are a number of strategies for freezing specifically that people find effective. So, for example, if you freeze while you're walking forward, you can try changing directions. You can try moving to the side for a couple of steps. Also, shifting your weight from side to side can often help you take that first step if you have gait initiation freezing. Stepping over things is thought to help people come out of freezes, so you can either step over a crack on the sidewalk or something that's actually on the ground, a laser light, or you can try to visualize an item to physically step over. Creating an auditory rhythm might help, so singing, humming, counting, or sometimes just stopping and taking a deep breath can help come out of those freezes. And then, while turning, instead of pivoting, try to make a rounded U-turn like in the picture. Another way to change complex activities is to break them down into steps and focus on doing each step subsequently. So this can make the task less overwhelming, and then it also helps you focus on each piece, again, reducing that autopilot mode that I talked about. So here's an example on the slide of how to get out of a chair safely in a stepwise approach. And then here's one for getting out of bed. So I actually had a better example specifically for getting out of bed for people with Parkinson's disease, but they were a real person's photos from a long time ago, and so I didn't have permission to use here. So I found this on the internet. It's actually for someone with back pain, which could be relevant. And it's very similar to what we advise people with PD, except not necessarily with the pillow. And then in between steps 3 and 4, to roll over to your side, we actually have the person use their forearm to reach across and help them twist their upper body. So I just wanted to point that out about that specific picture. But it's just an example of how you can break down more complex activities into steps. And so once you come up with the steps, you can create short versions or acronyms for those steps, and you can recite them out loud while you're doing them, or you can use signs or reminders strategically placed around your home to remind yourself of the steps or to use the stepwise approach. Other activity-related strategies have to do with taking a broader look at your day and planning your daily routine. So you're going to want to plan to do your more physically demanding or high fall risk activities at the time of day when you're feeling your best, and then potentially more sedentary activities when your functional mobility might not be at its peak. If you have fatigue, you might need to build in rest breaks or short naps throughout the day. And then in general, you're probably going to want to just start giving yourself extra time to get things done, to reduce some of that time pressure. It always takes me more time to get things done than I think it will. And so in thinking about people with Parkinson's disease, where you move more slowly, you have to be more deliberate about things, this is going to be even more important. And then this follows that you might have to cut your to-do list down a little bit each day. There's a plethora of adaptive equipment or devices available to help people do all sorts of things on a day-to-day basis around their home and to stay safe. And so I have some pictures at the end of the presentation that will be cycled through just for some examples that are particularly helpful for people with Parkinson's disease. But as I said, I mean, there are so many available to suit whatever need that you might have. And this equipment or these devices don't have to be used all the time. They can be used on an as-needed basis. So once you've gone through that goal phase and you've thoroughly analyzed and understood your problem, you'll be able to know when you may or may not need to use assistive equipment and devices. So you might only need your walker for at night when you need to use the restroom. You might only need a scooter for community mobility, but not at home. You might only need to sit while you're cooking dinner, but not necessarily breakfast or lunch. And then finally, in terms of clothing, you're going to want to avoid changing the types of footwear that you wear to reduce the need to adapt to different types of footwear. And then you also probably want to avoid long, loose clothing that could cause tripping or get caught on things. In terms of environment-related changes, when we're talking about home safety, these are often called home modifications. These are some general principles with a few examples, and again, I have pictures of some of these examples at the end of the presentation. So changing the layout to increase walking and turning space is a good idea. Adding different forms of support around the house, so that could be grab bars, especially in the bathroom, railings, walkways and stairways, and also places to rest. Raising the surfaces, your transfer surfaces, so your beds, your toilets, your chairs. Removing fall hazards and obstacles. Reorganizing things, the items in your home, to avoid bending and reaching. Also keeping commonly used items close at hand or with other items that they're used with. So this idea just has to do with sort of better organizing your home so that it's more convenient and safe for you to use. You'll want to make sure that your lighting is adequate in general, so bright enough, reducing glare, but also that you have additional lighting as needed. So that could be like night lights or flashlights. And in terms of cognitive home safety supports, you're going to want to reduce distractions. So turn the TV off or the radio off. And you can also add signage or reminders or prompts throughout the home to remind you to use, for example, your fall prevention strategies or your stepwise activity approach. And then I have this section on external cues for gait and freezing. There are various options for this. It can be highly individualized in terms of what works for whom. And there's a ton of research in this area, and so it's actually probably a talk in and of itself. So I'm just mentioning it here as an option, and I encourage you to see a professional if you do want to pursue that option. I have some pictures, too, at the end of some cues that are helpful for people with PD. All right, so you've brainstormed a bunch of possible solutions, and now it's time to pick one or a few and try it out. As I mentioned before, if it's a complex solution, you might need to list the steps or make a detailed plan for exactly how you're going to carry it out. So say you've come up with a solution of starting to exercise. It's not necessarily as simple as just going out and starting to exercise. You need to figure out what it is that you want to do for exercise. You might need to locate a gym or a class or somebody to do it with and figure out the schedule. So those are the steps that you need to sort of list out to make sure that you can achieve that goal. Also, if you decide to implement some home modifications or get some adaptive equipment, you'll need to figure out how to access those services. And this is a great idea, which I can't take credit for, but you can ask family or friends for some of these things as gifts. So I know these days people ask me what I need for my birthday or a holiday, and I can never think of anything. And so this would be the perfect opportunity to ask for some of these items that you might actually need. And I'm sure that your gift givers would probably love the idea of getting you something that would actually help you out, more so than getting you another tie or a candle or whatever it is they were going to get you. So don't be afraid to ask. All right, so you've picked your solution, and now you start testing it. And I want you to think of it in terms of testing or trial and error, because not everything is going to work for everyone all the time, and definitely not the first time. So you really need to approach it like an experiment. You're going to try it out. You're going to think about what's working or not working about it. You might give up on it and try something else, or you might just need to make some changes to it and try again, etc. And as I said before, you want to make sure you give it a fair chance. Once you've found something that seems useful, you can work on optimizing it, and then you can even layer in other solutions. So at least with falls and Parkinson's disease, I think all of you should, if you aren't already, should definitely adopt the exercise training solution for sure, and then try to layer in activity and environmental changes to further reduce your risk. So I've quickly gone through some examples of potential solutions for falls, but there actually exists a great tool developed by the Occupational Therapy Geriatric Group at the University of Buffalo that people can use on their own, on their own to prevent falls at home. And so it's called the Home Safety Self-Assessment Tool, and the whole thing is freely available online. I've provided the link, but you can also just Google it, and it'll come up. So this tool is so practical and useful. It provides a number of different things. So it provides a checklist with common home safety problems and solutions for 10 different areas of the home. It provides a list of 31 vetted assistive devices and products, provides step-by-step instructions and pictures for some common home improvements. It has a list of additional fall prevention strategies. If you live in Erie County, New York, there's a list of providers of home modification services, durable medical equipment, and other organizations. It also has American with Disabilities Act guidelines for the home environment, so how to make your home environment accessible, and an action log, so you can keep track of your home hazard removal process. And so I know this slide isn't very readable, but I'm just providing it as an example of the home safety checklist. So this is the kitchen, and you can see on the left side that it has pictures and a list of potential problems or hazards, and then on the right side, a list of solutions for each of the hazards and references for those solutions and problems. And so again, this is designed for anyone to use, and it's freely available online, so I encourage you to check it out. It'll really help you with your home safety problem solving. Finally, these are a couple other particularly useful links with strategies for improving home safety, especially related to falls, that I found online. So our very own Parkinson's Foundation has a page about home safety, and then AARP has this great infographic with 31 tips for future-proofing, they call it, your home. So you can do this process alone or with input from friends and family, but I also strongly encourage you to seek professional help. So there are people out there who are professionals in this realm. So you want to look for occupational and physical therapists in the area who specialize in movement disorders or Parkinson's disease or neurological rehabilitation or even home safety. And so you might want to look into your university movement disorders centers or contact your local PD organization for referrals. And for home safety, it's really ideal to find someone who will come to your home. But I've also done this sort of thing by using pictures that people have brought to me of their home, so it can be done sort of remotely. And I would say that it's probably worth traveling to a specialist. That might be more important to somebody that specializes in Parkinson's disease or home safety. That might be more important than trying to find somebody close by. So these professionals can walk you through that problem-solving process and help identify and implement the best person, activity, environment-related solutions. They can also provide assistance with procurement of those solutions. So they can help you locate resources, help you actually purchase the stuff, get the best deal, navigate the insurance system, etc. And so a few things to keep in mind as you embark upon this problem-solving journey. First of all, there's not going to be one magic solution. Many functional problems are complex and multifactorial, and so they may require multiple different solutions that depend on a number of variables. And along those lines, I want you to remember that it's an iterative process, so it'll require some trial and error. It's important to be persistent and adopt the perspective that if your plan or solution doesn't work, it's not a problem with you, it's simply a problem with the plan. So you just have to come up with or try another one. Definitely try to seek outside input from friends, families, professionals, every step of the way. You aren't expected to be able to think of everything, and oftentimes different perspectives help, so they can help you think outside of the box. And you may have to manage your own expectations a bit. So you aren't going to be able to completely eliminate every problem, but maybe a 70% reduction in a problem is still considered a success. And in general, I talked about this a little bit, but you need to make sure that what you're expecting from yourself on a day-to-day basis is realistic and necessary. So, for example, that fuzzball on the floor doesn't need to be picked up right now. It can wait until you're feeling better or until somebody comes home to pick it up. Also, remember the ultimate goal. So keep your eye on the prize. The purpose of walking isn't to walk per se, but it's to get from place to place. So when it isn't safe for you to walk, try a different way of getting from place to place, maybe a wheelchair, maybe a scooter. So think about why you do the activities you do and how you can still get that fulfillment or achieve that end goal in a different way. All right, so now moving on to some specific tips related to making living alone easier and safer. A lot of it just has to do with planning and organization. So, for example, you want a place for everything. Always put important things in the same place, your glasses, your keys, your wallet, your medications. Think about the things that you use a lot or information that you access a lot, and consider having multiples around the house to reduce the need for walking around to get them. It's just more convenient that way, and it'll improve your safety. You can also consider automating as much as you can in your home so that you don't have to think of it all yourself and so that you can control things remotely. If, for example, you forget to close the garage door before you leave on vacation. So you can do things like get timers or motion sensors for your lights, get automatic features on your appliances, so like something that shuts a burner off after a certain amount of time. There are a number of fancy integrated smart home systems that allow you to do all sorts of things these days, so they're worth checking out. In terms of medical emergencies, you're going to want to make sure that you have a way to contact emergency response very easily, especially if you live alone, because somebody's not going to be there to do it for you. So make sure that 911 is a click away, or that you have a personal emergency response system like a lifeline. You'll also want to make sure that your medical information is easily accessible to others. So that could be either in the form of a bracelet or a card. the iPhone Health app actually has an option to create a medical ID that's accessible from your lock screen, so anybody could access it from your lock screen. And you're going to want to make sure that you include the fact that you have Parkinson's disease in that medical information. You can also contact your local law enforcement, emergency medical services, or 911 operations to provide them with information so that responders know of your Parkinson's or that you live alone. So in my community, the police department's dispatch system, it allows them to flag any address to alert dispatch and officers of just about any situation so that they know what they're getting into if there's a call placed to your address. My community also has an access and functional needs registry, and so that's a confidential emergency preparedness registry of residents who have any condition that might warrant the provision of additional assistance during disasters. So I encourage you to look and see what resources are available in your community for sort of emergency response, so people know that you might have special sorts of needs. And then finally, since Parkinson's disease can cause swallowing problems, you should learn to self-Heimlich. Oh, and FYI, if you do ever have to self-Heimlich and it works, you're not choking anymore, you still need to seek medical attention to make sure that everything's okay after that. So we all know that Parkinson's disease is a complex condition, so even non-emergent medical care is a lot for one person to manage on their own. Again, the main tip along the lines of planning and organization is to prepare for your appointments ahead of time. So you want to think of and record questions to ask, and then have a mechanism for recording the answers and anything else that was said during the appointment. I put write on the slide. I know that's hard for many people with PD. You can also type, or better yet, use an audio recorder, or even better, take somebody with you to do this while you're talking with a doctor. The Parkinson's Foundation actually has this really great Aware and Care kit to help people with PD receive the best care possible while they're in the hospital. And it especially has a lot of information in terms of receiving the appropriate medications. So I'll show that on the next slide, but the link is also right here on this slide. And then in the event that you become unable to participate in medical treatment decisions, you're going to want to make sure you've designated somebody with durable power of attorney and that you've completed an advanced medical directive so that it's clear what you want to happen in terms of the medical care you receive. Again, relevant for anybody, really. So this is just a picture of the Aware and Care kit. There's a lot of detailed information on the website. And on the right is the table of contents for the hospital action plan. So you can see that it has detailed and practical information on what to do before, during, and after a hospital stay, and how to communicate about your condition. So very practical. All right, so this is, I think, almost the last topic, but it's possibly the most salient for those in the audience who live alone. Social isolation and loneliness is now recognized as a significant societal concern and a health risk. So much so that the UK now actually has a minister of loneliness, and about a month ago or so I was listening to public radio, and our past Surgeon General was talking about it. So social isolation and loneliness have been linked to all sorts of negative health effects, some of which are listed on the slide. On the flip side, social engagement has been linked to numerous psychological, cognitive, and physical health benefits. So for your health, for your daily function, and for your safety, it's really important to try to stay socially connected. So there are many ways that you can do this. You can become involved with your local Parkinson's disease organization, not only for social interaction and social support, but also for wellness and educational programming. You're going to want to keep people in the loop as to what you're doing. Schedule regular social appointments or check-ins. Join a class or a club related to your interests. Volunteer. So these things aren't only good for your health and well-being, but they also serve the purpose that, if you don't show up, someone is going to notice. You can also designate helpers from your social connections. So specific people for specific jobs that you might need help with. And use different people for different jobs so that you don't feel like you're relying all on one person or burdening one person. And then importantly, you can be their go-to for something. So you likely have some skills or knowledge that you can contribute, so the relationship can be mutually beneficial. So that's a way that you can ask people for help without feeling like you're burdening them in some way. Okay, so I've talked about this a little bit, but again, many communities have a wealth of resources available for people, so use them. That's why they're there. For Parkinson's disease, organizations like the Parkinson's Foundation or the American Parkinson's Association, they have disease-specific support, education, services, programs. In the U.S., we have area agencies on aging for people over 60, provide transportation, home repair and chores, meal provision, other community resources like religious organizations and community centers, and even libraries have these sorts of services. 211 is a free and confidential service in the U.S. and part of Canada that helps people get local resources. So lots of options. Oh, yes, and now, these days you can find almost anyone to do anything on the internet. And so these are a few of sort of the recommended and vetted websites. So sites like TaskRabbit, Thumbtack, and Home Advisor can actually hook you up with people to do home repairs and help you get the best bid. And GoGo Grandparent is actually a great way to get transportation. So it allows you to access the popular ride-sharing services of Lyft or Uber without needing to have a smartphone. So you can go to the website or you can call this phone number, and they have operators available 24/7 to help you get rides. You can even schedule regular rides as well. And you can set it up where it alerts family members just to keep them in the loop. So again, Parkinson's disease is a complex condition, and daily self-management, preparing for the future, making treatment-related decisions, it can be a lot for one person to consider and keep track of. So oftentimes having another person around is helpful for that. It also can be helpful for big things like falls and potential medical emergencies, but also even for little things, day-to-day tasks like changing light bulbs and preparing meals. But these challenges, they're not insurmountable for people who live alone with Parkinson's disease. They just take extra planning, organization, and a willingness to reach out for support as needed. And you, if you live alone or if you don't, you have control over this process. So you have a lot of expertise and knowledge and skills to help yourself and to help others and to seek help when you need it. Another point I want to make is that addressing all of these issues early is key for prevention and for maintaining your safety. So it's going to be harder to make changes once problems start happening because you're going to be burdened by the problems and it's going to become more stressful. So it's best to try to anticipate challenges, plan and take action so that you avoid problems before they happen. And so with that, I will end, and I thank you for your attention, and I think it will be time for questions.
That's right. Thank you very much, Dr. Foster. That was a fantastic presentation. It was great to see you as you presented. The questions that came in were just answered as you just waited another slide to go through. So you really, I think, did an excellent job on anticipating what people were really asking. But there's still some questions that are coming in that I think people would like to know, and maybe we can get a little more depth on them. One of the things you're showing, and we're seeing some of the adaptive equipment that's being scrolled through right now in some of the slides. Is that equipment covered by insurance? I mean, who pays for this stuff? I mean, and if it's not, how do you prioritize what you should do first?
Right. That's a good question. So I can speak in general to what I know about how it works in the United States. Insurance like Medicare and most insurance for older adults, because it follows Medicare, typically will cover what they call durable medical equipment, so special beds, things like canes, walkers, wheelchairs, commode chairs, but it won't really cover home modifications or adaptive equipment. If you're a veteran, VA insurance actually covers more, So it will cover durable medical equipment and equipment and devices. I'm not sure about home modifications, though. But most insurance, so a lot of this stuff you're left to sort of find and pay for on your own. But I will say that almost all insurance does cover OT and PT services. And so those therapists can often help you, speaking to your other question, they can help you prioritize which are the most important changes to make or equipment to buy. And then they can help you identify the specific pieces of equipment or modifications that best meet your budget. They can help get provider discounts. They oftentimes know of loan closets or places to get these sorts of things for low or no cost. So that's one way to sort of navigate the system. But unfortunately, insurance doesn't pay for everything. But the thought is that as we do more research and we sort of develop evidence for the usefulness of these products and changes, that they will eventually be covered.
Okay, that's fantastic. And you know, speaking of the questions that are coming in, I want to give a shout out real quick to Dan and my colleague Dan in Ohio. We've got 10 people there at a listening party, and we've got people
Great.
from all over the United States and 16 countries. We've got over 1,800 people registered for this call to listen to you, Dr. Foster, and we've got a number of folks, allied health professionals, nurses, people with Parkinson's, run the gamut, who really just been captivated by what you've been presenting. And speaking of, you know, some of the, again, of these tools and where to get them, I've got a question coming in from a care manager in Georgia, and this person asks about whether there's a central resource for ADA compliant companies that can provide these kinds of services, like building ramps and chairlifts and things like that, or is it, as you suggested, finding the local services through your occupational therapists who can do these home visits and know stuff? Is there, how would a practical way in each community grapple with the situation, trying to find out who to get this from?
Sure. So I think, you know, I may be biased as an OT, but I think that a therapist who specializes in home safety would be the first and most ideal person to go to, because they will have had lots of experience with possibly different providers and companies in the area, and so they'll know which ones, you know, might work the best. But I would guess that that these days there are a lot of providers that you could find through the internet that, you know, if they do work that's ADA compliant, or if they use universal design principles, it would say so on their website, or they would advertise those services. Another way, maybe a starting point, would be to look at that, you know, the home safety self-assessment list of providers in Erie County, and that might have some providers that are specifically in Erie County, New York, but that might also have sort of a national presence. But I would just, you know, start Googling, you know, ADA home modification providers or universal design home modification providers, and go from there.
Okay. You know, one of the things that I really liked was this general problem-solving approach that you had. You know, the 4 different things, and one of them was creating this fall log. How detailed does this fall log need to be? Is there, and when do you tell people, you know, when do you stop collecting data? Is it the first fall, second fall, or you just do this ongoing until your next physician's appointment or therapist appointment, where you can go over this information with them? Do you understand what I'm saying? Yeah.
Sorry, did you have more?
No, I just want to make sure that was clear, because I'm kind of rambling.
I think I got it, but let me know. So, you know, from my perspective, the more detailed, the better, especially at first. You know, once you have enough data, and hopefully you don't have too much data, because that would mean that you have many falls, but once you have enough data, you'll start to be able to, again, notice patterns and pick out the details or the information that is important. And so you can start, so I would recommend, you know, doing the fall log for as long as possible until you feel like you've addressed the problem to the best of your ability. And so another reason so you do the fall log to understand the problem and to come up with possible solutions, but you should still continue to do it to track the outcomes of your solution. So you can do things like counting up the number of falls that you had, before you implemented said solution, and then how many you had afterwards. And then you'll be able to tell what percentage reduction you've had in your falls. But I think it can be something to initiate, and then it should be done on an ongoing basis until you feel like the problem is adequately addressed.
Okay. Dr. Foster, is there a sample log online to take a look at, or is it just, as you mentioned, the kind of the who, what, where, when type of information, just to kind of capture in a...
That's a good question. So there may be a sample log online. I haven't looked. I have some samples that if somebody would be, if people are interested, I believe they can get my contact information, and I could send them out.
We can certainly make that available. If you were to, our colleagues on the back end can add that to the presentation as a slide with some information. So we can fix this in post.
Okay,
so
I'll do that. Sure.
And then, so some more questions coming in. When we think about these the steps you had on how to, these practical steps on getting up and issues like that, how easy is it to learn? As you know, many people with Parkinson's disease have some, at the very least, executive dysfunction. Many of them do, and then some cognitive dysfunction as their disease progresses that they have to grapple with. How easy is this stuff to pick up on a practical level?
Sure. So, the process itself, because it is a very explicit stepwise process, and, you can put it into writing, so you can use prompts to guide you through each step of the process. So people can just follow the rules, and so it's not like they necessarily have to memorize every step of the problem-solving process. I would say the hardest thing to do is to, and this is for people with executive dysfunction, and even without, if you don't necessarily have the requisite knowledge, is to come up with solutions for the problem. And so that's where brainstorming and not being afraid to be creative and coming up with anything you think of is very helpful. So just kind of let yourself go. But it's also where seeking advice or input from other people can be very useful. So the process itself, because it's a stepwise process and the steps are listed, they tell you exactly what to do, is not so hard to learn, but it's some of the details on the inside, coming up with the solutions and maybe implementing them, where I would, if people are struggling with that, I would suggest they seek help again from family, from friends, from professionals, from that home safety assessment tool. So there are resources out there to help with the details. Okay,
that's perfect. And one of the slides I was going through there was just talking about our ATTP program for allied health professionals, and I have a follow-up question to that, which we were just talking about, Dr. Foster, about falls and the steps of dealing with it. One allied health professional in Tennessee is asking what your best single piece of advice might be for people who repeatedly fall in order to try to avoid falls. Can you do that? Is there a single piece?
Oh, man. Again, it's hard because it's so, it can be so individualized. But, gosh, I would say the dual tasking and thinking about those environmental changes that I listed on the environment slide, which I know is a number of different changes, but
it seems like the very practical one of just decluttering your house seems like a really inexpensive and simple fix to really help people navigate the environment they're in all the time. Would you say that's kind of a good thing to do?
Yeah, I would.
Okay, perfect.
Good answer.
And thanks. I paid attention. So I want to tell our audience we've got our survey for this expert briefing that's online now, and I encourage everyone to take it. This information we utilize, provide feedback to Dr. Foster, but also utilize to make certain that every year our expert briefing series is the best it can be. And so I know for our 10th year next fall, it's going to be superb based upon the effort everyone has been putting into to give us the feedback on direction and guidance. Some more questions, Dr. Foster, and they relate around the bedroom. A purchase like a mattress is often an expensive purchase, and so a care partner in Rhode Island is asking about what kind of mattress to purchase. They want to buy one. Her husband has Parkinson's disease now, and it's not an issue because it's an early stage, but they want to anticipate his future needs. Is there a specific type of mattress? I mean, should you stay away from foam mattresses or pillow top? I mean, what's your advice?
Oh, yeah, that's so I would say, probably stay away from those memory foam mattresses and pillow tops. So you want something that's high, but that's a little more firm, so it's easier to move around. So because not only getting in and out of bed that can become difficult, but moving around in bed can become difficult as people lose some of their mobility. So something that's firm, on the firm side, would be better for that.
Okay, and then so there's in bed, but getting in and out of bed. We had some pictures of some of the equipment.
Yes.
Is there anything in particular? I mean, I guess to help people make that transfer. Is it?
Yeah. Can I cycle back through these slides, or?
Yes. Yeah, we can.
Okay. So something that I have found that has been particularly helpful for people with Parkinson's disease is on. Oh, I just tried to click on it. Or
should be coming up.
I don't know if I have control. Okay. So is it bed? It's called a bed cane.
She's going to go to the slide. There we go.
Okay.
Perfect.
Wait, I see I'm not seeing it. Okay, are we on it now?
I don't see yet. There's a slight delay, but we're getting there. There we go.
Okay. So it's called a bed cane. So you can see that on the bottom center is one bed rail, but then the picture on the rightmost side, that's a bed cane, and that is actually one of the most favorite devices that my clients with Parkinson's disease have used. And so it's a way to help you turn in bed, and then it can also be used to help you get in and out of bed.
Oh, very interesting.
Yeah.
I've seen some people talk about using a pole.
Right. Yeah, there's a pole.
The pole goes right beside the bed. Is that useful too, or what are your experience with that?
It is, yeah. So that's useful. The other longer sort of rail can be useful. There's also a strap that can hook down if you have a footboard at the foot of your bed. There's a strap that can go around that, and then you can just use it to pull yourself up from laying. So all of these things can be useful. It's just a matter of finding what works the best for you.
So it's a little bit of trial and error then on trying to do that.
Yeah, it can be. Or, talking with somebody or figuring out what specifically you need this piece of equipment to do. Because, it's not going to be practical for people to buy a bunch of devices and return them, although that is possible. But, yeah, you just that's, again, where understanding the problem comes in and really understanding what specifically your needs are in terms of function as well as aesthetics, because that matters.
Yeah, absolutely. I know that my in-laws have moved in with us, and we modified our bathroom for them and able to get grab bars that look really nice, and not terribly expensive either. So it doesn't all have to look like it's institutional.
Medical, right.
Yes, medical.
Mm-hmm.
So some more questions. For people who aren't yet having these problems, can they do this on a prophylactic or preventative basis to try to see if it makes certain they're ready for the next stage of their disease? I mean, or do you have to have falls before you can start seeing an OT or PT?
No. You can do it preventatively, and I encourage you to do so. I should have said that from the very beginning. But, yeah, prevention is key. And so many of the things that I talked about and just thinking about home safety and what's coming down the road can and should be implemented preventatively, because oftentimes it's harder to make these changes once you've had a problem. You can see an OT. You can also see therapists preventively, so you can start thinking about it on your own or seeing professionals, and they can help you better plan for the future. I'll also say that some of these principles, go along with the concept of universal design and going back to our discussion about aesthetics and, what you want your home to look like. And so universal design is a way to make spaces more accessible for everyone. And so it doesn't, so something that might help you now, if you're worried about like resale value or something like that, typically these changes are things that are seen as being good for any sort of person. So you don't have to necessarily worry about that.
Okay, that's good to know. I want to give you some feedback since you're here, Dr. Foster. I know we're coming up to the top of the hour. Excellent presentation, very resourceful. Thank you so much. With great presentation with so much information from New York. Allied health professional in Illinois said very good presentation. It was person-centered, and they said they hope to incorporate the general solving approach to falls as part of a patient education approach. And so they thank so much for learning about that. 2 more questions, if I may,
Sure.
As we go through. What's the best way this is a person who's with Parkinson's in Arizona, who live in remote and rural areas. How do they able to live alone? I mean, how do they find the resources that they need to do that?
Right. So I know it's harder to access lots of stuff in rural areas. There are, OTs and PTs usually that can be accessed from any area. It might take longer to get somebody, but home health people can come out to your house. Again, lots of information and resources on the internet. Telehealth or telerehab might be an option to pursue if you do have internet access, so you can talk to people remotely. I know that there are some services, I don't remember the details of them, where you can actually take a camera around your home and show therapists what's going on, and they can help provide recommendations there. But also, as I said, I truly believe that it's worth traveling to see somebody if needed to get some of this assistance. So even just for 1 or 2 sessions, if you can find, an OT or somebody that specializes in Parkinson's disease or home safety somewhere nearby that you can travel to them and see them and take pictures of your home and discuss your problems to get some of that input, I think that would be helpful.
Okay. A little PSA real quick. I just want to mention that our expert briefing series is going to start again in the fall, Tuesday, September 18th. So mark your calendar, same time and place online and at the 1 p.m. Eastern Time. And I want to thank again our sponsors for this, AbbVie, Synovian, and Lundbeck. They helping to make this series possible. We're doing everything we can to use your feedback, and the surveys just was on the screen, to improve our webinars on what we're going to be doing next. And for those who want to remember this and too busy trying to take notes or listen, we'll have an archive of this. It's going to be posted next week on Tuesday, June 12th at parkinson.org. And for people who have questions, of course, you can feel free to call our helpline, 1-800-4PD-INFO. That's 1-800-4PD-INFO. And then, Dr. Foster, my final question for you, and this is from a person in California. We've talked about living alone and everything that you need to do that, but how do you decide when you're no longer able to live alone? What do you use to make that decision?
That's a good question. So I think that if at any time you're starting to feel uncomfortable yourself about living alone, I think it's worth exploring other options and maybe talking to people to get sort of an outside perspective. If there are home safety issues that are severe that don't seem like they can be rectified or mitigated to your satisfaction, that might also, prompt you to consider, seeking alternative living situation. And then in general, if you just feel like you're ready to live somewhere else and not live alone anymore, I mean, there are a lot of great benefits of moving to assisted living facilities or long-term care facilities in terms of, social interaction, things to do, people that are available to offer you assistance. So Again, I think it's highly individualized, but it's also worth seeking input and advice from your friends, your family, and also your physicians or other medical professionals about sort of their perspective on where you should be living.
Okay. With that, Dr. Erin Foster, thank you very much for your time today. It was a wonderful presentation.
Well, thank you. My pleasure.
Good. Thank you. And thank you all to our listeners. And this concludes our 9th Expert Briefing Series, and I look forward to talking to everyone again in the fall. Have a good summer.